Hello again, guys. Welcome back to another video. This is my channel. My name is Patrick Mackenzie. This is a channel for nursing. This is Nursing Practice Made Easy. If you are first year, second year, third year, fourth year student nurse, if you are in a doctoral program, a master's program, if you're doing the BSN, if you are doing the ADN, this is your channel. This is a one-stop shop for nursing, and this is where nursing practice is made easy. Nursing practice can be very complex too, especially the beginner nurse who is just starting out. So last video we have started looking at the nursing process, looking at the components of the nursing process. We said the nursing process, of course, is a systematic way of providing nursing care. It's a systematic way of providing care to the human response towards diseases. All right. So the 5 components of the nursing process we talk about add pi. So we're assessing and diagnosing and planning, which includes the outcome and the goal setting, the implementation and the evaluation. So the last video that was done, and I know you enjoyed the video. I have seen a lot of reviews. I've seen a lot of subscription. I really want to say thank you, guys. And don't forget to subscribe. Don't forget to like. Don't forget to share. This is a very good channel to get the information to every nurse. Whether you're just starting out in school, whether you're at the end of school doing some exams, or whether it's practical exam or looking to sit the written exam, or even if you're sitting some written exam in classroom or written exam in school. This is your channel. If you have issues concerning understanding aspects of nursing, this is your channel. So whenever you watch these videos, leave a comment. You can also indicate what kind of videos you'd like to see as it relates to the type of topic that you'd like to see. Of course, is there topics that deal with? We'll be dealing with a whole lot of topics. Fundamentals of nursing will be covering, of course, clinical nursing practice, things that has to do with research, has to do with nursing management and management applications. Everything will be here. But of course, we have to start out by laying the foundation as it relates to utilizing the nursing process, because this is what we use to come up with solutions and solve the problems for our clients. Our clients meaning the individual, the family, and the community. These are the clients that we have to deal with. So last video, we did look at the assessment, and we talk about what is the assessment. We say that, of course, it is the gathering the data, organizing the data, and of course validating the data. We looked at the types of data gathering tools that we need to, the sources of data and the type of tools that we need to gather the data. So of course we did talk about our interview process, subjective, objective data, and gathering all of that information. We talk about validating it and using our communication skills to validate that data. And so for one now to get to diagnose or to come up with a problem, one must first have a very good assessment, because the assessment that we gather and the information that we put together is what is going to determine the problem, and that is what is going to indicate the need that the patient has, and which need is more of a priority than the other. So today we want to look at the second component in the nursing process. We want to talk about diagnosis. Of course, I'll be setting up my studio shortly just to make sure that all our whiteboard and everything is all set up. But for now, this is all good that you can listen and understand, and just make it plain and simple so that you can understand it, of course. So the second component in the nursing process is diagnosing, right? And what is diagnosing? Now, we want to give you Nanda's definition. I found Nanda's definition to be a very good definition, all right? And so Nanda, on their website, they say that the nursing diagnosis, it is a clinical judgment about individual, the family, or the community response to actual or the potential health problems, and it provides the basis for nursing interventions for which the nurse is accountable, of course. So I did say NANDA, and one would say, NANDA, what's that? All right, so NANDA, this is an organization that has started out in 1982, North American Nursing Diagnosis Association. All right, but in 2001, they had to rename themselves NANDA International. Now, what was NANDA all about? NANDA is an organization of experts, nurses come together, clinicians, they come together, and they say, let us see if we can set up one standard that will guide nursing practice and to guide the nurse as it relates to the problems in the care the nurse wants to identify. And so before that, it was left up to everyone's clinical judgment to come up with something. And sometimes it could be a hit or a miss, right? But they wanted to standardize the whole thing, streamline the thing, so that the nurses could have one language when it comes on to using the nursing process. And so out of research, evidence-based practice, and all of this, they came up with a set of problem statements. And these problem statements are geared towards the various needs of the patient. And these problem statements are also geared towards speaking to the different systematic problems that the individual or the family or the community might exhibit. And so as a result of that, there was that NANDA that we use now, because these are a standardized set of problem statements that are written, and these are well researched, they are evidence-based, and it is a guide for the nurse to use when it comes on to directing the care, selecting the right kind of interventions for the patient, and to see if we can get the best outcome where the patient is concerned. So that's what NANDA is all about. So now this standardized set of nursing problems that have been written, it is making us know that it is not for us to really pull something out of the sky, pull something out of the hat like a rabbit or so, but we definitely have to have some guideline that we go by. And these are accepted guidelines that are accepted worldwide in every jurisdiction, of where nurses practice, and nursing is practice, and this is really good. So that's what NANDA is all about. So that's what the diagnosis really is, as NANDA puts it, and it's really a beautiful definition, I must say, as the real diagnosis. So basically, the nursing diagnosis, the problem statements, it shows us problem, it shows us cause and effect, and it also shows us what the need really are, and what needs were those tailored from. Nursing diagnosis really shows all of this. Now, there are 4 types of nursing diagnosis. So there's what is called a problem-focused diagnosis. And this problem-focused diagnosis, you also know it as actual diagnosis. So problem-focused. The problem-focused diagnosis comes from the assessment that the nurse makes, from that initial assessment. Because one of the things that we did not mention, or I did not mention in the last video, was when you talk about the types of assessment. So you do have initial assessment, and you do have emergency assessment, and you have ongoing assessment. The initial assessment, this is the first assessment that is made by the nurse, and this initial assessment must be very thorough, because this is the one that allows us to pick up all the information that we need moving forward. If we miss out something that is very important, we're going to have problems to find the right need, as in what the priority need is, or might miss it completely, or we also might end up in problems choosing the right problem statement or the right diagnosis, and as a result of that, we might end up treating the wrong thing or setting up the wrong care plan, and then that can spell problems or spell disaster both for nurse and patient. And so this is really how serious that is. So the initial diagnosis must always be thorough. Emergency diagnosis is really one of that it's really just go straight to what the problem presented, and what is the need currently presented, and what the focus is on that, right? Doesn't really take into consideration the other systems, just emergency, right? And then ongoing assessment, of course, is that we continuously monitor and make adjustments where necessary and all of that. That's all of that where that is concerned. So now when we talk about the nursing diagnosis or the problem statement, is that assessment that we make, it must be thorough, it must be good, so that we can capture all the need, all of what is going on with the patient, and then that will help us now to decide what is it that we're focusing on. So one diagnosis, then talk about 4 types of nursing diagnosis. Number 1, problem focused diagnosis, aka actual diagnosis. What's the actual one there, or problem focus that we are seeing? And that problem focus is based on what we assess, the information we gather. So we must make some good gathering on our information when we're doing that. All right, and then now the next kind of diagnosis that we have is what we call a potential or risk diagnosis, right? And this diagnosis is because there are vulnerabilities that are present, or there might be certain hazards present that can put the possibility that something will happen, or something that the patient has in their possession, or systemically in the case of giving them like certain medication that makes them vulnerable to certain injuries or vulnerable to certain problems. So that's that risk, that potential problem. And then the other type of nursing diagnosis that we have is what is called a health promotion kind of diagnosis, aka wellness diagnosis. So health promotion slash wellness diagnosis. A lot of people more familiar with wellness diagnosis. So that's the other one. And then number 4 is what we call a syndrome diagnosis. So syndrome is really because there are a number of problems created, one spin-off from the other, one spin-off from the other. A syndrome, let's say a bedridden person because of impaired physical mobility. So it started off with, say, muscular dystrophy. Muscles going to get weak, and then they were no longer able to walk, so now they're bedridden. And with that, there's demineralization of the bone, so here comes fractures. And with that demineralization of the bone, there's a lot of calcium that is released in the blood, and so now we get calcium stones in the kidneys. And then here comes some bed sores, and then here comes some problems and some other problems. A syndrome actually develops. All right, a syndrome develops. So syndrome diagnosis is really what? So when you have one problem that a plethora of other problems spin off from it, we're talking about a syndrome diagnosis, just simply put. And like I said, it's nursing practice made easy. All right, so those are the 4 types of diagnosis that we have. But when we look at diagnosis itself now, what are the components of a diagnosis? Not all 4 diagnoses will have the same components, but the problem focus or the actual diagnosis has 3 components, right? So the 3 components is the problem statement, and that problem statement comes from NANDA, from the NANDA list, right? And NANDA will update their list every 2 years, sometimes every year. Something pressing comes up, but every 2 years. But most times you'll have it updated every year. Either they continue and say there are no changes, or there are minor changes. So the 2021 diagnostic label or diagnostic list is out, and that's the one that we use when we talk about current practice. So that's what we talk about when we talk about current practice. That the NANDA diagnosis is one of the indication of current practice, because all of these diagnostic problems or labels that we get is really based on it's evidence-based practice, and so we use them. So you can always find your NANDA list if you Google it. If you go and you'll see NANDA 2021, if you go to the NANDA website, which is the best place to go, and you will find the most recent list. It's usually posted on their website. That's a good source to find that NANDA list. All right, so the problem focus diagnosis or actual diagnosis carries 3 parts or 3 components. All right, So component number one, we say, is a problem statement. And that problem statement is not something that we make up ourselves. We get it from that NANDA list that has been well researched, and it's really an evidence-based statement that we're going to be using. And then the other component now is the etiology, the cause. What is the cause or the risk present? Why this why this one comes up or this problem came up? And then now the signs and symptoms or the clinical presentation is the other component of it. So when we put them together, we get a complete diagnosis, right? If you only put the problem statement, you really only put a label, and your nursing instructor will say to you that the diagnosis is not complete. And if you write it on your care plan, the nursing instructor will tell you it's not complete. Or if you're not under a nursing instructor and you're practicing as a nurse for years, then of course the label is really, it states what the problem is, but it doesn't give any indication of the cause of the problem and why is it that you say that it is present. In other words, what are the symptoms, the signs, or the evidence that is there? And that is what completes that diagnosis, right? So how now does one determine the best NANDA label to use or the best diagnostic problem to use? How does one determine the best problem statement to use? To determine the best problem statement, you first want to identify the need that you found in your assessment. What were those needs and what systems were those needs pointing to? Were they pointing to physiologic or were they pointing to psychologic? Now, when you talk about needs, all right, and how does one identify these needs? So here it is. Now, you have two types of needs, and those two types of needs now, there are specifics for the two. So you have the physiologic needs, and you have the psychologic need or the psychosocial need. Now, what are the specific physiologic needs? So if say your preceptor were to ask you, or your nursing instructor were to ask the student, what are the specific physiologic needs? So it say, okay, what need did you identify for this patient? And the student might say, it's a physiologic need. Or the nurse might say, it's a physiologic need. So then the next question would come with, what specific physiologic need are you looking at? So here are the physiologic needs that you must bear in mind every time you go into clinical practice, whether you're a seasoned nurse or you're an advanced beginner, whether you're a novice, a competent, an expert. Here's a refresher. The physiologic needs that you want to always bear in mind, because these are the ones that will help you to look to determine, is this the need present? That will also help you to determine what the problem statement that you want to come up with. So Abraham Maslow, or Maslow's hierarchy of needs, which is something that every nurse is familiar with. All right, Abraham Maslow. Now, Maslow, if you read on his history, you will see that psychologist, sociologist, but he also had some form of depressive issues at some point, and as such, out of that, he was able to really put all of this together and say, all right, you know what, these are the needs that human beings would have. And so nursing has adopted it. Why did nursing adopt Maslow's hierarchy of needs? Because that's really what nursing is. It takes a holistic approach. And when you look at Maslow's hierarchy of needs, it does have a holistic approach, because it not only looks at the psychological, but it not only looks at the physiologic, it looks at the psychosocial, the psychologic, it looks at the dimensions of health in it when you really take a good look at it. So now, but applying Maslow's hierarchy of needs, if one were to actually look at that triangle that is presented as a hierarchy of needs, at the very top we see self-actualization, and at the base, of course, we see basic human needs: food, clothing, shelter, and we climb up love and belonging and safety and security, and all of these things we see on it. But how do we take that to just simply apply it when we are in clinical practice? Now, here is it. Now, the needs that you always want to bear in mind for physiologic are these. So it's oxygenation is the first one that you want to look at, because we usually look at that one as priority and top. Oxygen. Why? If there's really no oxygen, there's nothing more you can do for the person, because oxygen is really what keeps the body alive. And so oxygenation, and under oxygenation, you look at the airway of the patient. Is it a patent airway? Is it clear? You look at their breathing. How are they breathing? Are they having something like a Kussmaul's respiration, as in the patient with diabetic ketoacidosis? Are they having some chain strokes or some Biot's respiration? Whatever they are having, all right, how is their breathing? Is it labored? What is the depth of it? What is the, in terms of the rhythm of it, how is that doing? So we look at their breathing, and is that going to affect their oxygenation? And then, of course, we look at circulation. Now, circulation is not only about the volume that is moving in terms of circulatory volume. We're not only just looking at circulatory volume. We also have to look at the source of the circulation. So that takes in now the heart. So in terms of the stroke volume, in terms of the cardiac output, how is that? Is the heart giving us a good cardiac output? Is that adequate to perfuse the entire system when it goes in one stroke? Is there enough blood to go around? So we talk about that. And then also circulation, we also look at the hemoglobin content. Do we have enough hemoglobin chain to make enough heme available so that oxygen can bind to? So if the hemoglobin is low, there's not enough for oxygen to bind to. So that's going to create a problem with circulation in terms of, is the person anemic? All of these things. All of that falls in circulation. All right. And blood pressure also falls under that. Perfusion falls under that, right? Is the heart muscle getting enough? Is the brain getting enough? All of that is oxygen. And that is why now, when you look at certain exam questions and you want to identify oxygen need, no matter how the question is written, right? You don't have to just straight look for something that is mentioning oxygen, because a lot of times that's not really how the question is written. Because if the question is written to really assess the nurse or the student at, say, the synthesis or the evaluation level or the level of analysis on Bloom's taxonomy, then you're not really going to just see something simple. But when you are able to pull all of that out of the hat, you'll be able to identify all of that if you're answering a question. But we're really talking about, clinical practice here. And so oxygen need, that's one of the physiologic need, and that's number one you always think about. Safety and security, that's another physiologic need that you think about. And safety and security, of course, is the patient is in any immediate danger. Are there any complications from the procedures that they just did or they're going to do? Are there any complications from the medications that they are on? Are there any complications from the equipment that is being used on the patient? Is there any problems in the environment that create danger for the client or for the family or even for the staff that is in there? So all of that, safety and security, right? And then there's the rest. The rest is another physiologic need. Is the environment conducive for rest? How about the environmental stimuli? Is that too much? Is the lighting too much? Is the noise too much? Is the patient coming into the facility? Is their rest pattern disrupted because they are not in their house anymore? All of this. What did they do to fall asleep when they were at home? All of that is a part of the whole rest need. And then the comfort need, is there discomfort? Is there pain? Is there discomfort with the equipment that we now have to put on the patient? Is there discomfort in the way we have to posture them just so that this can be well and that can be well? So we look at comfort need. Is there discomfort because we have to repeatedly do a finger stick to get to do the randomized glucose or the GMR, right? Is there what's discomfort in that? If they have to repeatedly get insulin injection, is there discomfort in that? So we look at the comfort need of the patient. All right, just breaking it down for you. And then, of course, there's the activity need. So we look at that. Are they able to move around? And if they can, to what degree are they able to move around? So we look at all of that as it relates to activity. How much activity can they tolerate? How much can they do before they're tired? Shortness of breath. Do they have broken bones? Are they in a cast? All of these things. Activity is another need that we look at when we do our assessment. And then, of course, there is the nutrition, fluid and electrolytes, nutrition. We can also bunch fluid and electrolyte under safety and security, because if that's an immediate need, for example, the patient is dehydrated, all of this, and is about to start seizures, that really falls up under safety. But the nurses uses clinical judgment in determining where we fit what or where we fit what. So nutrition is another need. Elimination is the other need. And elimination, as we look at both bowel and bladder elimination, that's another need. Is there a problem with that? All that. So those are the needs that you will be identifying when you do your health assessment. And when you gather a good assessment, you will see where the problem arises according to the assessment that we took, or according to the assessment that you take. And then now there's a psychosocial or the psychologic need. All right. And that now has to do with the emotion, the cognitive aspect of it, anxiety, depression, how the patient feels about the care, how they feel about being in hospital, extra strenuous activities or problems like what's going on at home, how is their spiritual well-being being affected, all of these things. What's their education level? Are they understanding what is going on? Do they have an awareness of all of this is going on? It's all psychosocial, all psychological needs that we look at. So when we talk about the Maslow's hierarchy of needs, and how do we apply this? This is really the practical application of it, and this is what you must bear in mind. So when you're making a care plan or considering a care plan, this is how you really put the care plan together. These are the things that you think about. But then now, to choose the right problem statement, which is the diagnosis, we first must get a good assessment, very thorough. If we miss something in the assessment, then we're going to run into problems. We might very well miss the major diagnosis that we need, or the need that is really most of a priority. We might miss that, missing something in the assessment. And bear in mind that if you're going to make a diagnosis or choose a problem statement, that problem statement must match or must be congruent with what is written in your assessment. So a diagnostic label or a problem statement cannot be used if it is really pointing to nothing in the assessment. So if it's not in the assessment, it cannot be used. So if you're making a care plan, and the care plan requires, of course, a care plan always requires you to be thorough about it. So if you make a care plan and the assessment is read, and that the label is saying something, or the problem statement is saying something, but then when you look in the assessment, there's nothing in there that says that, then you know that's not something that you want to do. That's flawed. So that's the whole thing when it comes on to how do we go about picking out the right thing out of NANDA list, the right diagnostic label or the problem statement. First, identify that need that you have in that assessment. What was the focus? And that's why we call it a problem focus diagnosis, because it is coming off an area of focus, and the area of focus indicate the need. And so that's why now when you find that your area of focus was GI system or respiratory or so, that was where the area of problem focus was. Now you can go to the NANDA label and say, all right, let me see what NANDA has under as it relates to this particular need here and this system. So under safety and security, specifically to the GI system, or specifically to the cardiac, or specifically to this. Let me see what they have, and let me see if it meets the criteria. Now, what do I mean when I say, does a diagnosis meet the criteria? So for a diagnosis to be considered major, there are certain criteria that it must meet, and for it to be considered minor, criteria. So there might be just one thing or so present that would say, well, all right, is this an immediate problem? No, this probably might be something down the road. But there might be a number of indication or present that say this is a major problem that I need to take care of. Now, when you do your assessment and you gather all your information, this now will lead you to do what is called a diagnostic cluster. Now, what is a diagnostic cluster? A diagnostic cluster is because when you do your assessment, there are a number of problems identified, or a number of areas of focus identified in that assessment that warrants a problem statement for each. Now, if you put a problem statement for each, or a diagnosis for each, you end up now with a number of diagnoses that we call a diagnostic cluster. Now, in that cluster, you might have major problem and minor problem. Now, what you do now is that you look at your cluster, and then you will see that there is a diagnosis that if you take care of it, it will take care of 5 more. We call that an umbrella. It shelters a lot more. It will take care of 5 more. And so that now helps you now to limit and to chop away and probably come down to 2, or probably come down to 3, or bring you down to the major one. And later on in other videos, when I am taking you through some questions and show you how to apply using the nursing diagnosis to answer questions and to pull out the answer out of it, combining the nursing diagnosis with the needs and pull the answer out of it. But after we have done the nursing process, and then now, of course, when we're putting everything into perspective, how do I apply this when I'm answering an NCLEX question, or an RENR question, or a question for whichever nursing exam is done? How do I apply this? How do I apply this when I am in clinical practice? How do I apply it? This is really what we're talking about. So when you do that and you identify all the needs that you found in the assessment, then that now will carry you over to choose now the right NANDA, the problem statement, or the nursing diagnosis, and then of course help you to complete the diagnosis. So let's say now, for example, your assessment, the patient has chest pains, and it's not relieved by a nitro. The aspirin didn't do anything for it. A 12-lead EKG says there's depressed ST segment. There's the depressed ST segment, and the patient has a history of coronary artery disease. So we realize that it's not responding to conventional treatment. The patient is complaining of severe chest pain. Now we look at it and we say, all right, so chest pain is what you're complaining of. And these are the things that I'm seeing, that you have depressed, you have a depressed ST segment on your EKG, and also your troponin levels are really out of the normal range. They are high, and the aspirin didn't work, nitro didn't work, and all of that. So now we conclude, obviously, that this patient now is having a problem with blood flow to the heart muscle. So we look at it, we go over to NANDA, and we say, all right, let's see what they have to say about under circulation, or let us see what they have to say about cardiac and all of that. So you look under that and you say, all right, this patient is exhibiting chest pain. There's a depressed ST segment, a depressed ST segment. There is the nitro that didn't work, the aspirin didn't work. There's a history of coronary artery disease, and of course we have some elevated troponins. And so now we realize that, okay, this heart muscle is not getting enough oxygen. So what would be the best label to pull out here? We're looking at a circulation issue, and we realize that the heart muscle isn't getting enough blood to carry oxygen to the heart muscle or the myocardium. So it gets ischemic, and of course, that's where all of that pain comes from. So we identify that we have a circulation issue here and an oxygenation problem. So we're looking at the oxygenation to see what's the problem statement concerning the heart. We will come upon something like ineffective myocardial tissue perfusion. All right, and that makes sense because there is not enough blood getting to the heart muscle, and so as a result of that, we get in ischemia and we get in the pain. Now the pain presents another problem. Now the patient has a comfort need. All right, because there's pain, so the patient is not comfortable. So now we have altered comfort. We have some acute pain going on there, and that is related to decreased oxygen supply to the heart muscle. That's really where all that pain come from, evidenced by the patient is rating the chest pain as an 8 out of 10, clutching the chest, and it is not relieved by, of course, the conventional treatment. So we see another problem right there. But as for the perfusion of the heart muscle, so we have ineffective myocardial tissue perfusion. What is the cause of that? What is the etiology of that? Decreased blood flow to the heart muscle, narrowing of the blood vessels that supply the heart muscle. That's the problem. All right. And what is the clinical indication that we have? We have the patient holding on to the chest, complaining of chest pain and rating the pain of an 8 out of 10. It's not relieved by rest, and it is not relieved by conventional treatment. All right, so we see, so now we have the problem, and the problem statement is complete. So having done that, now we look at other problems surrounding that. So the comfort is another need that comes off it. So we have this altered comfort. This is acute pain, which is specifically what is causing the altered comfort. And then the patient now is also expressing anxiety and fear, because they don't know what the outcome is going to be. So now they are fearful. So now you have another problem on your hand, because now you have a psychosocial need where there's anxiety and there's fear because the patient is uncertain of the outcome. So it's related to the uncertain outcome of the process or the progression of the process. The patient probably might make a statement in the process and say, I have done everything I can. I just don't know why this heart won't be fixed. So now later on you have some education to do in looking at the lifestyle and what is going on, and to see if there's something else that this patient wants to do. So now we can come down now to realize that to find the right diagnosis, we must first have the right kind of assessment. And then we must first identify the needs under that, because then that will help us to show exactly where we want to look under NANDA to find that problem statement that goes with this problem that we're having. And that way now you don't miss on your diagnostic labels, you don't miss on your problem statements where doing all of this is concerned. And so therefore, when it comes on now to diagnosing the problem, we follow these steps, and so we can come up with the right kind of diagnosis. A lot of times student nurses get confused and run into problems in how do I find the right NANDA label? How do I find the right diagnostic label here? Right? And so, this is usually some of the problems that we have. But make sure that the assessment is thorough, the assessment is good. Then look in the assessment to identify the areas of focus and where the problems are and the systems that are affected by those problems. Then go over to NANDA and let us see what they have to say under these things that you have come up with. And so now we have a standardized label or standardized problem statement that we can use. And then that now is going to guide us into determining what outcome and what goal we want to have. In other words, how do we want this problem to be fixed? What outcome do we want when it comes on to this problem? And so this is really what we're talking about, diagnostic. This is a second component of the nursing process, and this is the one that deals with identifying the problem. This is the one that shows cause and effect, and this is the one that guides the goal or the outcome that we are going to need. And it also is going to speak to the types of interventions that we're going to need later on in order to fix all of this problem. All right, so now having spoken now about our assessment, and now having spoken about our diagnosis, and we say that our diagnosis, of course, according to what Nanda writes, and I like the definition, it says that it is something that explains the current health problem and the interventions that are needed by the individual, the family, and the community. And of course, it also describes the possible reasons for the problem, and it also will point the nurse to the intervention that the nurse is accountable for. And so this is really what we're talking about. Now, we say that we have 4 types of nursing diagnosis. So that's a problem-focused one, which is also referred to as an actual diagnosis, which is problem-focused, straight on that. And then, of course, we have our potential or risk diagnosis, and then there's the health promotion or wellness diagnosis, and then there's a syndrome diagnosis. And we said that the problem-focused diagnosis or the actual diagnosis, it has 3 components. So it has a problem statement that we get from NANDA, which is a standardized set of problem statements that has been well researched, and of course evidence-based practice. And then there is the etiology or the cause of the problem, and then there is the symptoms or clinical presentation or the evidence that such it is. Those are the 3 parts of your nursing diagnosis. And we went on to talk about how do we identify, where do we take the problem from, and what is a diagnostic cluster. We talk about that, and how do we go about finding the priority need or the priority problem that we need to fix immediately. The problem can be more than one problem. It can be one, it can be more than one. Normally, when you get your NCLEX questions or questions in other jurisdictions, they are somewhat similar, because usually the question is saying, it gives you the presentation and it tells you what is happening, and then it will ask what would be the nurse's priority response, or what would be the initial response by the nurse, all of that. When we get down to those videos where we're looking at the questions and putting all of it together, but first, we want to make sure that we get an understanding of the nursing process, and how do we apply the nursing process in our day-to-day practice, and how can we apply this on answering questions, as well as how can we use this to solve problems in the day-to-day running as it relates to our nursing practice. We do that. So now, having the diagnosis, having the right problem, having identified the right need that the patient has, or the family has, or the community has, the next thing we want now is to set a goal or outcome, right? And this is where the P comes in, and the P is planning. All right, now let me caution you though that in some jurisdictions where the notes is written on paper chart, and let's say you're a student nurse and you're really writing off the notes on the paper chart, documenting, so you do the assessment and then you come up with the nursing diagnosis, right? The plan here is not what you are going to do, because sometimes the students tend to make the mistake and say the plan is that, I'm going to give this person 3 meals, I'm going to go do this, I'm going to do that for the person, that for the person. That's not planning, that's implementing. The plan here is really, when you talk about plan, we're talking about what our outcome is, right? And that is really what we're talking about, what the outcome is. And so the outcome or the goal is what it is that you want to happen at the end of all this. That's what that P is for. It's not really, a lot of times people make the mistake and think that the P is really what you're going to implement. No, the P are the goals and the outcome that you're really looking forward to, and this is what you're going to write down. So for example, let us say for this client that we used hypothetically earlier, with the coronary artery disease and the ineffective myocardial tissue perfusion, what is it that the goal will be? What is the outcome? In other words, the plan is that within, say, 15 minutes, right, the patient will have adequate cardiac tissue perfusion. And that, of course, you can always say, evidence by how is it that I'm going to know that he's having that? Why? Because his chest pain, he's going to say, is down, probably him reporting a chest pain of 2 or 0. And by the way, guys, don't forget that when it comes on to the heart muscle, as long as there is pain, even if it is 1 out of 10, the patient is still having a perfusion problem to that heart muscle. So though the patient might have initially have say an 8 out of 10, and then when the medication is given, or so in this case, this patient would definitely need a PCI, a percutaneous coronary intervention. But let us say, otherwise you say you want this patient to report a 2 out of 10 pain. A 2 out of 10 pain is good for the heart muscle, but it's still not good enough, because as long as there's pain, it means that the perfusion problem has not been resolved, right? But nonetheless, what you need to see improvement. So that would be what you're talking about, what the plan would be, the goal, the outcome is what all of this will be. All right. And so now we want to go about now talking about a goal and what a good goal is and all of that. And that's what we're going to be doing in our next video, guys. That's the next step in the nursing process. The P, right, as in the plan, right? Setting the goal and looking at what the outcome is. And so until next time, next video, hope you enjoyed this one. I hope this was a good refresher for you. Open up your understanding, make it simple for you, and so you can improve and become better nurses, as well as if you're struggling in school concerning the nursing process, this is good for you. All right, don't forget to subscribe, don't forget to like, don't forget to share, and don't forget to make sure that you get this to all nurses and students, both those who need a refresher and of course those who are just coming up in school. This is very good for them, plain and simple. So until next time, guys, I'll see you.